You mentioned about Dr. Beverly Whipple. In fact, I remember reading an article in which she mentioned about cervical orgasm. Again, something which is inside, going back to the Freudian concept of, PVI as the standard form of sexual intercourse. And in fact, in that article, Dr. Beverly Whipple had mentioned, the cervical orgasm as a shower of stars. What do you think about such statements, even from sex researchers themselves trying to, perpetuate this traditional assumption regarding sex as PVI?
Yeah, I find it frustrating because it defaults to this idea that penises are the things that give pleasure. And when it is that the case for some people, but not everyone. And my understanding of cervical orgasms is they do seem to be a way for people with spinal cord damage to have an orgasm. So for most of us, the nerves that run up our spinal cord are what help us have orgasms. But for people with spinal cord problems that can't get orgasms from clitoral stimulation, some of them can have orgasms from cervical because it goes through a different pathway. So it goes through the vagal pathway, which doesn't go through the spinal cord. But to my knowledge, it's not very common to have a cervical orgasm, or at least it hasn't been documented in the research, outside of people with spinal cord damage.
Okay. The funny thing is that I have men asking me, what is the ideal penile length to achieve, cervical orgasm in women? So I'm like, what, dude? I mean, is there any ideal penile length? Because it is supposed to be at the end, right? I mean, what is your thoughts on that?
For stimulating the cervix or for hitting the cervix?
For attaining cervical orgasm.
If it is possible in people without spinal cord damage, it depends on the length of the vagina as well. Because as a woman gets aroused, her uterus and cervix, like her vagina, lengthens.
Okay.
So even if it's only 3 inches away when they're not aroused, it can be longer. But also many people find something hitting the cervix to be painful and uncomfortable.
Okay.
And so it's not necessarily a goal. For some people, maybe, but I think... So I would say probably 6 inches, maybe, would be able to reach the cervix, depending on the position. But for a lot of people, that wouldn't feel comfortable to have something constantly hitting their cervix.
Okay. So, Doctor, again, I'm forced to ask the same question. So how much of our cultural assumption on sex has actually influenced even the sex researchers and doctors in approaching and looking at sex when it comes to, problems relating to orgasm difficulty in women?
I think we can never underestimate how much the cultural influence has on everyone, and especially researchers, right? If you're raised in a world that says penis-vagina intercourse is the main thing, then you're going to study that and you're going to focus that. And I think there's just this male bias that in most cultures that we live with the assumption that what works for men is also best for women. And of course, we know that's just not the case. And so everyone is influenced by these social influences, even researchers.